Interstitial cystitis, also known as painful bladder syndrome, is a debilitating condition that can affect both women and men. An innovative market-leading treatment distributed by Aspire Pharma, which can be self-administered at home, helps to restore and protect the bladder lining, relieving the symptoms and reducing the suffering of the patient. Sharon Thomas reports.
You've had the bladder treatments, you've completed that course. Going forward, if we could, it would be good to teach you to do it yourself. You've seen the syringe, it's very straightforward.
Kath Walker has suffered with bladder problems for nearly 30 years. It's been utterly miserable.
Awful, really, really awful, that I couldn't go anywhere, I couldn't plan very much, because of the situation with my bladder.
During the pandemic, with so many clinics closed, most consultations were on the phone. Kath's consultant introduced her to a product called Ialuril, which helps repair and replenish the damaged layer of the bladder lining. And she can now learn to self-administer, should she choose to. Until now, she's been managing on antibiotics alone.
I'm pain-free and no backache, no bladder pain, and no rushing over to my GP for antibiotics and things. And, I can plan my social life far better and not having to revert around my bladder situation. Changed my life, absolutely, yes.
We're now going to look at administration of Ialuril using the adapter.
Ialuril is used for the treatment and management of recurrent urinary tract infections, chemical or radiation-induced cystitis and interstitial cystitis. Interstitial cystitis, or painful bladder syndrome, that causes debilitating long-term pelvic pain with increased urgency and frequency of urination. During lockdown, patients were taught how to administer Ialuril themselves via nurse-led online videos. Steve Foley is a Reading-based urologist. His clinic has been carrying out bladder installations for more than a decade.
During the time that COVID's created this need to treat more patients in the community, we've been able to accelerate what we were already doing. We're teaching patients to do their own Ialuril treatments at home, a course of 6 initially, going on to a monthly, and by being able to do it themselves, they're able to take control, they're able to feel like they're in control of their own bodies and their own condition.
Patients like Kath have been left with little option during COVID. Aspire worked with clinicians who clearly wanted to focus on the immediate needs of their patients. This meant the management of chronic conditions like Kath's could be managed in the community or at home rather than in hospital, while specialist staff still have oversight of their patients. Aspire is a specialty pharma company which offers a range of products across many therapeutic areas. Like so many others, the Hampshire-based firm had to adapt quickly when COVID hit hard. So, as part of the evolution of Ialuril, they worked with community partners to introduce an adapter so patients could self-administer at home without the need for a catheter.
COVID has been a really turbulent time, not least of all for the patients. And at Aspire, we're focused on the patient welfare and their well-being to increase their quality of life through the products that we actually deliver. We've spoken to the nurses, we've spoken to the clinicians, and through the introduction of the Ialuril adapter, we've allowed this quality of life to be improved by treatment of patients at home.
Aspire worked closely with patient groups, many of whose members have the condition, to introduce this new innovation, making the class-leading Ialuril the only treatment that can be instilled directly into the bladder without a catheter. Tell us a bit about your condition and what sort of a difference it's made for you, the fact that you can now self-administer.
It's difficult living with the condition. It's a very challenging condition. It requires some flexibility. Being able to self-administer an installation at home gives that flexibility and means that you can do it at a time when it's convenient for you.
Aspire hopes that highlighting to clinicians and patients how successful this shift to community management of these conditions has been during the pandemic may continue to help relieve pressure on an already overstretched NHS in the future.
It's given me my life back, my social life. I'm living again, properly.